Well, continuing our health watch this morning, for those who are sick and need to speak with a doctor but who don't want to sit in an urgent care or ER for hours, there is an alternative. Dr. Pollyanna Pitt joins us now this morning from Tele-health to tell us how easy it is to schedule those visits. Thank you so much, doctor, for being here.
Of course, thank you for having me.
Now, we're in the season for getting sick, like the flu, maybe even getting COVID again. What are some of those symptoms of some of these illnesses, especially flu, if we're not quite sure we have it?
Oh, definitely. So if you find yourself having nasal congestion, headaches, body aches, nausea, vomiting, it can be either flu or COVID. Norovirus is one of those things that has been coming out more recently. It's been around for decades, but we've seen increased cases with that. Norovirus as just gastrointestinal symptoms, so you're not going to see the nasal congestion and the sore throat that you see with flu and COVID. But the flu has sudden severe onset of symptoms. You're usually contagious one day before symptoms start, and you can see severe acute symptoms. So you'll see early on body aches, high fevers, along with the headaches and the nasal congestion. And then eventually the fatigue and the weakness start to set in with some loss of appetite.
Well,
with
Dr.
COVID, sorry.
Go ahead. No,
with
go ahead.
COVID, the symptoms tend to be a little bit more fluid. So you'll see over time that those symptoms build and you're contagious for about 8 days, but 2 days prior to onset of symptoms, you're contagious at that time as well.
Okay, so how can we get some help from telehealth? If we have some of these symptoms, we think this is going to be sort of a distant thing. How do we get help from you guys by not going into a doctor's office?
Of course. So we are literally a finger click away. You can go to tele-health.com or you can use our app, our mobile app, and you can use our services there. Just type in Tele-health mobile app. Some people have us as a subscription option through their insurance, but rest assured, if you don't have that benefit, you still have the option of scheduling a visit with us for some of our other services, including mental health and our acute care, like our Gen Med services that will still see you and help you through this process while you're sick.
And I would think some people may be a little bit apprehensive because they're used to going to the actual doctor, going in person to the healthcare providers. How is this different? And how do you think people are thinking in terms of getting help that way?
So going into clinic is very antiquated, right? Like there are so many things I can tell you about a patient's status just based on seeing you from your chest up. I can tell you if someone's having respiratory distress. I can see if you are weak and lethargic. With that being said, usually I tell the patients, hey, I've noticed you have a cough and some nasal congestion. Is anything going on? And so we are able to assess your vitals. You literally put that information in when one of our medical assistants who will do your triage process. We also have registered nurses who are available on our platform as well. So you still have access to the auxiliary staff. We are all board certified physicians, and we also have nurse practitioners who will also assess your needs and create an individualized plan for you.
Okay. You're also able, I'm sorry to interrupt, but you're also able to give prescriptions. Tell me how that works.
So after we assess you and we determine whether or not you need any imaging, any labs, which we can also order, we will discuss options in terms of treatment with you. And depending on your symptoms for these illnesses, we usually try supportive care, but depending on if you're still within the window for Paxlovid or Tamiflu, those are also options. So we'll write a prescription, send it to your pharmacy via e-submit, and you'll have an electronic prescription that you can pick up probably within an hour.
Well, we appreciate this information. How can people get in touch with you guys at Tele-health if they do have some of these symptoms and need some of these services?
Of course, just schedule an appointment with our virtual care services at Tele-health at tele-health.com or go through our mobile app, through Tele-health mobile app, and we are more than happy to see you. You can see your eligibility online and schedule an appointment.
Thank you so much, Dr. Pollyanna Pitt, for being here from Tele-health.